We have heard, or when I went through my training, cancer of the breast was a disease of the 60s or 70s or the elderly women. However, in the last couple of decades, we are seeing a shift to the left. We are seeing more and more young patients being diagnosed with cancer. In fact, world over, breast cancer continues to be number one cancer in women across the globe. Even in India, where we used to think that cervical cancer is the most common cancer, now breast cancer has superseded cervical cancer. What has happened in the last couple of decades that breast cancer actually has become more common as compared to cervical cancer? It's probably all related to a better understanding of the disease and also changing in our lifestyle. A 23 years old young lady who appeared for a MPSC examination last week and was probably in a mood to relax after all the pain and sleepless nights which she has gone through for past 6 months preparing for the examination. Yesterday, she incidentally noticed a breast lump. Staying at a place little far away from Nashik, she reached out to a gynecologist who advised a sonography of the breast and surprisingly showed this sonography revealed a 3 centimeter of breast lump which appeared to be malignant or a cancerous. So the entire world had taken a U-turn. Someone who is preparing to get into the civil services as soon as the results come through suddenly has to walk into a cancer hospital being surprised. So breast cancer at the age of 23 years. Was there some mistake on the part of the radiologist to diagnose it? Actually no. One of my youngest patients of a ductal carcinoma of the breast whom I have operated upon, the 21 years old young girl. Breast cancer, why does it happen? One of the reasons which we say is the aging related process. But a 23 years old girl getting breast cancer, is it only aging? Could be related to genetics also. In fact, BRCA1 and BRCA2 mutations are one of the most common causes of breast and ovarian cancers. It can also cause prostatic cancers in men. Speaking of the men, breast cancer does not happen only in women. 1% of breast cancers are known to affect men as well. The breast part of men has also a predisposition for developing cancer. We are talking about gender equality. We are talking about women who are really getting onto their professional front, taking care of their professional commitments along with their family commitments. So we know that the age of marriage has shifted. So later marriage, later childbirth, less number of children, less duration of breastfeeding, all of them make the lady more prone for development of breast cancer. If there is a family history of breast or ovarian cancer or prostatic cancer in your first or second degree relative, please do not disregard it. What should be done to prevent breast cancer? A healthy diet, adequate exercises, keep a check on your weight. Obesity is one of the most common causes of breast cancer. Smoking is one of the most predisposing factors for development of breast cancer. So please cut down or avoid smoking or alcohol. And equally important is that please follow the nature's biological rule. Marriage, childbirth, lactation or breastfeeding, all are equally important milestones in a lady's life. If you are to have breast cancer doesn't happen overnight. It's a slow growing process. So how to detect breast cancer? Every lady after the age of 20 years should learn to do breast self-examination. As a person, you understand your body the best. So any small changes in a breast tissue can be picked up at the earliest by yourself rather than any doctor doing a mammography or a MRI. When to do breast self-examination? Preferably on the 10th day after your menstrual cycles. On a regular basis, if you do it, how to do it? There are multiple literatures available on Google also, how to do your breast examination. Along with that, after the age of 40 years, once in a year, you should get your mammography. Mammography is a combination of X-ray of the breast along with the ultrasonography and a color Doppler. Mammography is done with the intention to pick up any small abnormal area or focus of calcification in the breast. It picks up breast lesions at the earliest. Along with that, in case there is a lesion, then a FNAC or biopsy is required. But before going through mammography, it is fine for those ladies who do not have any symptom, where after the age of 40 years, some nations take it as 45 years also. You should do it on an annual basis till the age of 60 years. In case you have had a close family first degree relative who has had breast cancer, then the screening starts 5 years before the age at which your mother or sister or aunt was diagnosed with breast cancer. If your aunt was diagnosed at the age of 38 years, then your screening starts at the age of 33 years. This screening involves mammogram, and in case there is a risk of developing cancer, then even a BRCA, which is a blood test to pick up genetic mutations in the body, where germline BRCA estimation is done to find out if you are at risk of developing cancer. What are the symptoms or warning signs of breast cancer? I think the most important sign or symptom is having a lump in the breast. Usually these lumps do not pain. Hence, unfortunately, a good number of women disregard it or neglect it, saying that it is a painless lump. However, any painless lump which continues to grow slowly, please do not ignore it and reach out to a medical attention immediately. The other symptoms would be blood-stained nipple discharge, usually from one side, any ulcer on your nipple or on your breast area, a swelling in the armpit, a swelling in the lower part of the neck, and once the cancer is spread to other parts, it could be cough or abdominal pain, backache, jaundice, headache, and other symptoms. But before reaching out to those symptoms, I think it is the simplest way is to learn to do your breast self-examination. In case there is a breast lump, reach out to a specialist, get your mammogram, get your biopsy done. If it is negative, be happy about it. In case it is positive, don't panic. Breast cancer is now a curable cancer and there are adequate scientific measures to take care of it. A large number of women avoid to reach out to a specialist with the fear that if it is cancer, then the breast will be removed and their femininity would be disturbed. However, I would like to put in a word over here. Now, breast cancer surgeries are done without disturbing your femininity, without removing the breast, and cancer can be completely taken care of with minimum damage to your breast tissue. And also now chemotherapeutic options or radiation options are such that it is not going to disturb your day-to-day life also. So breast cancer, if it is there to happen, it is best to pick it up in an early stage and take care of it where it does not affect your life or compromise your functionality in the years to come. Thank you very much.